So hello, my name's Dr. Mark Howard. I'm a Consultant Histopathologist at King's College Hospital in London. Histopathology is one of the medical specialties which not everyone knows about, but a lot of people have had unknowing to them experience of what we do here in the hospital. It's the study of cells and cellular material, usually to make diagnosis of diseases and conditions. We also work very closely with our colleagues in surgery, oncology, radiology, in terms of both analysing the tissue and helping guide the oncologists in particular in the best ways of treating things such as cancer. We now need to find out what was the actual cause of the reason for the lack of blood supply, and then we'll create our report and feed it back to the surgeons. I chose histopathology, and again, it's a specialty that very few people go to medical school thinking they'd like to become a histopathologist, mainly because very few people have heard of histopathology. I chose histopathology mainly because before I went to medical school, I was a scientist working as a virologist at University College London, and so I was very interested in laboratory medicine, but I was also interested in the clinical side of things, patients. And histopathology gives what I felt would give me the best opportunity to work with and for patients, but also to work in an area which I was familiar and comfortable and I loved working in, which was the laboratory.
This is the main lab. Okay.
Histopathology is an extremely important specialty. I know everyone who is in whatever specialty say their specialty is very important, but we support a huge range of patients through their patient journey. So very, very many of the patients that come to our hospital will have biopsies or have operations where tissue is removed, and it's our responsibility to examine that tissue, make the diagnosis, and I say work with our colleagues in the other specialties to make sure those patients don't just get the best treatment, but they get personalised treatment so that the outcome for the patient is the absolute best it can be. So these are our patients in histopathology. These are our patients. We care much about them being glass slides, as members of the A&E department do about the patients in A&E, or the ITU care about the ITU patients. So although we're one physical step removed from the actual patients, they are with us in this form, and this is where we do our medicine. Histopathology and living patients, this is a bit of a joke within the medical world, that histopathologists just sit in our offices with our microscopes and we don't see anybody. It's not true at all. Quite a large number of histopathologists will have direct patient interaction. There are various clinics that we attend. One of the big areas of progression in diagnostic histo and cytopathology in the last 10-15 years has been what we call ROL, which is rapid on-site evaluation of cases. So I will go into the clinic where the clinicians or the radiologists are taking small specimens of cells, maybe from a lump in, say, the neck or an area of discoloration of the skin, and we'll be able to put the cells from that lesion straight onto a microscope slide, stain it there in real time, and look at it under the microscope to help essentially determine, if not the diagnosis, at least that the lesion has been sampled in real time. The other patients, of course, which we deal with a lot, and I do as an autopsy pathologist, is that I do conduct post-mortem examinations, predominantly for the local coroner here in London. And although those patients aren't living patients, they are my patients, and I give them every care and consideration and my duty of care to them as any doctor would with their patient. And I am their last doctor. I am the last doctor who will be able to make the diagnosis of why they died, and it's a great privilege to be able to do so. So these are the tables we use when we make the post-mortem examinations of patients. I do remember one particular case, which was of a relatively young gentleman who came into hospital. He was very, very, very ill indeed, and it was felt that he would need intensive care treatment, and they didn't. The diagnosis was not obvious from the initial examinations. So a biopsy was taken, and because he had symptoms of that might be something wrong with his bowel, so a bile biopsy was organised, and that was brought to my laboratory on a Thursday lunchtime. We had a bank holiday weekend coming up, and so we knew that time pressure was on us to try and get the diagnosis before the bank holiday weekend, where the lab, although running, is not running at the highest level of staffing. So we were able to, with fantastic support from the laboratory team, make sure we had what's known as a rapid processing of the specimen. So the specimen was prioritised right to the front of the queue, was put through the processing machinery and staining machinery, and I was able to look at the first slides from that case early on the Friday morning. My suspicion was what we call a differential diagnosis, so I thought the problem could be one of 2 or 3 different things, but I needed the help from the advanced diagnostics team in order to do the very sophisticated analysis that they can offer. But I needed them to do it a lot quicker than they normally would. They do it very quickly anyway, but I really needed the turnaround the same day. And they worked amazingly and incredibly to get the result out to us later on that Friday afternoon. It was, as I had suspected, that he was suffering from a type of lymphoma, so a type of blood cancer. One of the things about lymphoma is that it responds very quickly to chemotherapies, and so we were able to discuss with the acute oncology team at the hospital what the findings were, and they were able to start treatment that very same evening. And over the weekend, his condition improved immensely. And by the Monday, when I came back into work, I got word that he was doing very well indeed. So the important thing I felt at that time was to get together the team. So get together the members of the laboratory, members of the advanced diagnostic team, and go through what we've done. Really is a patting ourselves on the back, I think. It's what we do day in, day out. But in this case, it really felt to me that we'd gone, and the team had gone well over and above their usual great standards, and played a big role in his subsequent recovery. So we're all very proud of that. So obviously, like with all the members of the general histopathology lab, we work particularly closely with the advanced diagnostics team. Medicine, and histopathology in particular, has really moved into the 21st century. And we now talk, as we do, about personalised molecular medicine. So I work with the whole hospital, essentially. There's hardly an area of the hospital we don't work with very closely. In terms of my own department, I work with about 40-50 people regularly, and that's a whole range of people with very different skill sets. So the secretarial support staff, the laboratory staff, the molecular scientists, people in the mortuary, people in the bereavement office, my colleagues who I work with all the time, the registrars who we're training, the training grade doctors. So it's a really wide spectrum of people that we work with.
I started off being interested in autopsies when I was 16 in a public mortuary. I saw the certificate saying anatomical pathology technologist, and I was like, I really want to do that.
My favourite bit of the job, so what is my favourite bit of histopathology? The fact it's never the same. It's never the same on 2 days, and you don't know what's coming your way. And it's endlessly fascinating. I learn every day things. Hopefully I don't learn too many new things every day, but I do learn new things at least every week, which is healthy. It challenges me. It means I have to bring all the skills and skill set that I have to bear. And I like the fact it makes me a good team player, because in histopathology you work as a team and you work as a group, so we constantly spend our time showing each other cases, discussing cases, really fascinating areas of research to be involved with, teaching, educating the medical students, teaching our registrars. So although our week has a rota to it, which looks relatively similar, sort of week by week, if you go hour by hour or day by day, it's very, very different. The case will then go off to the multidisciplinary team meeting so that it can be discussed between the pathologists, the oncologists, the radiologists and the physicians as well, and a plan for this patient we put together and put into action, and the patient will be seen back in clinic in a few days after that, and treatment will start. So what's my average day as a histopathologist? So if I'm on the rota for doing autopsies for postmortems, then the first thing I'll do when I come into the hospital is go to the mortuary, see which cases, if there are cases to be done that day, and talk through with the mortuary staff what our plan is for that particular case, whether it needs any special measures, because it may be a case of an infectious disease, or if there's any special equipment or additional information that I need. We'll then get ready to perform the post-mortem examination, which I do together with the mortuary technicians. That normally takes around about an hour to 2 hours. So then I'll come into my office via the laboratory, see in terms of the specimens which have come into the department which I will be responsible for that day. I'll liaise and talk with the registrar who's working with me. They and I will organise how we're going to do the specimen preparation, so-called cut-up. And then I'll go to my office and look at my in-tray. As histopathologists, like everyone else, we have in-trays. See what cases have been prepared for me by the laboratory. And then really I start triaging my day, deciding which cases have priority I need to look at first, also attending meetings here in the hospital and very often outside the hospital. And then really sort of from about mid-afternoon I'm starting to think about what I'm going to do the following day. So I would go back down to the mortuary, see if there are any cases for autopsy for the following day. I'll be chasing up if my reports are ready for authorising so that I do the final authorising of the reports. Make sure the registrar I'm working with is happy with how their day's been going on. Probably have a final check-in with the lab, in the last hour of the working day to see if there's anything they need me to do. The endless emails, of course, always fun to go and do those, and normally leave them to the end of the day unless they're urgent. And then shut the door behind me and up Denmark Hill to the train station.
So during those 5 or so years, you will rotate around different hospitals and experiences of teaching hospitals, district general hospitals.
So our teaching is very varied, and we are one of the disciplines who does a huge amount of teaching. We do teach them at undergraduate medical students. There is an area in the syllabus which is involved with pathology. So at the very beginning of their training, the medical students will be taught about normal tissues and what normal tissues look like under the microscope. As they progress through the years, they'll have the opportunity to have teaching on what diseases look like under the microscope. And especially here at King's, we have a very active autopsy service, and we have many medical students come daily to come and see the autopsy examinations and the findings, which really gives them an idea of how the disease process happens in the human body itself. But it isn't just the medical students and our registrars we teach. We're also involved with teaching and assisting the biomedical scientists. We may have teaching plans with, the mortuary anatomical pathology technicians. So it's a varied amount of teaching, and I love teaching because it keeps you up to date. If I wasn't teaching, I don't think I'd be as good a pathologist as I hope I am. So there are literally hundreds of research projects going on at King's, covering all the areas of medicine. My particular areas of interest are research into gastrointestinal disorders, and so I will be working closely with colleagues around the hospital, both on very clinically applied projects and some more pure research projects. It's an exciting time to be working in those fields.
I'll assist Mark doing the post-mortem, so I'll eviscerate the body for him, I'll take out all the organs, and just make him aware of anything that I found along the way.
Does my job give me the right balance between work and the rest of the life? I make sure it does, and I'm kind of passionate about that. I have been, when I was a very junior consultant, very new consultant, I have to admit I let work get a bit ahead of me, and it sort of took over life a bit, which is okay for a little while. And there are times when things are very busy that you have to put other interests to one side for a few days or maybe a few weeks to get projects finished and in terms of research projects or audit projects. But I now am very strict with myself that there has got to be an equal balance between work and relaxation and activity. So I love running, I play cricket. I would like to take up a few more activities now that I'm living in London again, which maybe rowing, maybe dance class. So I hope and I try and actively make sure that I do fun stuff and I do work stuff, and neither of those two get out of balance. Do I get it right always? No one ever does. But I think probably I'm doing as best as I can. So, you don't
Yeah. Love it.
So in terms of part-time working and flexible working, histopathology is really sets the gold standard, I believe, in the NHS for flexible and part-time working. We have in histopathology the highest proportion of what, I don't like the term part-time trainees, but trainees who don't work a full working week. They work a number of days a week because they have other responsibilities, childcare responsibilities, looking after other family members, or just having other interests. And histopathology has always been a discipline which really welcomes people who have, through what they need to do in the rest of their life, the need to work less than the traditional Monday to Friday 9 to 5. This piece of bough doesn't look entirely normal. It looks a bit too dark and dusky and purple. Really healthy bough would be a much lighter pink colour. So the training in histopathology is quite straightforward, and it was one of the earliest disciplines in medicine that has so-called run-through training. So if we go back to the start of medical school, there's 5 years of medical school. After medical school, there are 2 years of what we call FY1 and FY2 foundation year training in medicine and surgery. And then for histopathology training, you can enter the training scheme after those 2 years of being a junior doctor. The training scheme is between 5 and 6 years in length. There are 3 exams that need to be passed. One at the end of the first year, one people normally take the following year, and then the final Fellowship of the Royal College of Pathology Part 2 exam, which you take at about 4.5 years. And then that gives you the fellowship, or makes you a fellow. You become a fellow of the Royal College, and then you can also add on specialist abilities through other examinations such as gynecological cytology, autopsy practice, and then you can subspecialise in those fields as well.
Architecture looks a bit effaced.
Yeah, absolutely. So we're not seeing the normal architecture here, are we? We're not seeing the normal germinal centres and follicles. Tips for medical students wondering about coming into histopathology, I think come talk to us. Come and talk to us. Come and find out what we do. Obviously, we will be talking to you and interacting with you mostly in the mortuary, and as an autopsy pathologist, you'll have the opportunity to talk through with me what happens in a life of a histopathologist. The mortuary is our most public face when it comes to the medical students, but there's always opportunities to come and see what we do in the laboratory. There's always opportunity to get involved in research. It's a really, really varied work and life being a histopathologist. It's not just looking down the microscope, it's about patient interaction, it's about many interactions with clinical colleagues. And it's a hugely satisfying and enjoyable discipline to be part of, and I feel very honoured that I've been able to do that.